trying to find ways to improve your current practice, or perhaps you're a young doctor and you're just starting out with your new practice. I'm going to give you ways which you can improve or add to your current practice, either to increase your income or perhaps even just to give yourself some more free time by being more efficient. So we essentially want to do that by upskilling your practice. But what exactly does that mean? Not to be confused with upscaling your practice, although when you upskill your practice, you will ultimately upscale your practice. So to put this simply, this is the process of enhancing your knowledge and skills and capabilities for your healthcare providers as well as your staff to further meet the demands of your patients, and also while adapting to recent new trends in technology. Or simply, we're trying to make ourselves better so that we can do more for more people over time. These enhancements in our skills will make us more competent for our patients and give them more reasons to come back to us over time. There are multiple ways of doing this, but I've essentially broken it down into 3 categories to make things much easier. The very first method is what I call clinical skills expansion. Clinical skills expansion is where we are adding more procedures and skills to our knowledge base and also being more specialized in certain fields. So from a procedures point of view, you could, for instance, do a minor surgical skills course, which would allow you to do procedures such as removing ingrown toenails, draining abscesses, removing minor skin lesions so that those can be sent off for histology for further studies. This would allow patients to skip some visits to either, say, the surgeon, a podiatrist, or a visit to the dermatologist, which may take months and months to get. You could learn some skills like intra-articular injections, which could help in carpal tunnel, tennis elbow, or frozen shoulders, or perhaps some osteoarthritis in the knee. This could possibly delay a patient's visit to the orthopedic surgeon or delay a procedure that they may need in the future, or a large surgery that may inevitably be needed, but it would give them some time. You can also do courses on aesthetics such as Botox or fillers, obviously for aesthetic reasons, but also Botox can be used for things such as grinding of teeth, or also in patients who have hyperhidrosis. You can also learn point of care ultrasound. This could help you better diagnose a lot of your patients, which could prevent some unnecessary testing or unnecessary referrals outside of the practice once again. And you could still bill patients for those procedures and therefore increase your own income and helping the patients along the way to prevent further more expensive procedures. And then by adding equipment such as ECGs or spirometry, if you better your skills in reading these procedures, then you can essentially also add things such as doing medicals for insurance for patients, where they want exercise stress ECGs for patients. From a specialized knowledge perspective, what you could do is you could add things such as travel medicine to your repertoire, which would allow you to help patients with both helping them with whatever medication they may need or vaccinations they may need, and also just giving advice to them. This would simply help you with diagnosing patients on a day-to-day basis while still helping them. You could also get some extra specialization in sports medicine. This would obviously help a lot of your patients where they've sustained some sports injuries, and you can assist them in their recovery plan. You can also get extra training in emergency medicine, and this would once again just help you on a day-to-day basis with many of the common emergencies that might walk into your family practice. Occupational health is another area of specialization you could go in, where you could add visa medicals or mining medicals or cruise ship medicals. Some people even focus their whole practice solely on occupational health this way. Area number 2 of upskilling your practice is what I call practice efficiency and systems. This essentially is where you're improving your efficiency either from a doctor perspective or an administrative perspective, so that you can either make things smoother and see more patients, or it can help you a bit with work-life balance so that you're still able to see the same amount of patients but have more free time. So firstly, for your medical administration or reception, what you could do is improve their knowledge on medical coding and billing. Getting some extra courses in programs such as Excel could just improve their administrative speed with some of their daily tasks. Even just improving their medical terminology can help them firstly with customer service on helping patients on a day-to-day basis, but also with better understanding doctors to improve efficiency when doctors are communicating back to them. Investing in AI tools is also something that is becoming more frequent these days, which could ultimately decrease the workload for your administrative staff and in some cases actually eliminate the need for some of them entirely. From a doctor's perspective, if you essentially improve the systems they work with to be more seamless, so simple things such as having a faster computer will speed up your daily workflow, and also keeping things digital, from digital notes as well as having digital scripts, digital referrals and digital sick notes go a long way in speeding up and reducing doctors' admin. And once again, with the introduction of AI tools, there are tools such as Autoscribe or Heidi, which can automatically record your patient notes during a consultation. This saves hours and hours for doctors every day, so that they don't have to manually write their notes after every patient, which can once again improve the length of time that you spend with each patient, but also allow yourself to possibly have more free time so that there's less time simply doing admin during a day or at the end of the day, which tends to happen most often. And section number 3 is improving your formal qualifications or certificates. And this is about upskilling your credentials so that you just essentially have a better formal backing for your skills. You can also obtain extra diplomas. So this would involve possibly obtaining some extra diplomas for your practice. I think the most valuable ones would probably involve things that deal with some of the more commonly presenting scenarios that you see on a day-to-day basis. So diplomas such as the DipPEC for emergency medicine are really valuable. I think extras can be things like a diploma in psychiatry or HIV or dermatology. These are things that you might commonly see in your practice as well. There are other valuable diplomas such as the DA for anesthetics, but although this can add to your income, it doesn't really add too much to your practice, as it rather adds to somebody else's practice. You can also focus on your certificates such as your ACLS, ATLS or PALS, just to make sure that those are always up to date, as they are always changing, so it's good to keep up with those things, especially from an emergency perspective. And another simple way, which actually we should be doing anyway, is just keeping up with your CPD points on a yearly basis. This keeps you a bit up to date with some of the more recent changes. So why would you actually want to do all of these things for your practice? It just kind of sounds like extra costs and extra training and more time for yourself or staff members in your practice. Sure, there will be an initial sunk cost, but basically over time this will become less and less later and translate into more income for yourself over time, or more free time for yourself over time. And that'll be because you'll be able to see more patients in a day, or you'll be able to bill for more procedures, or you'll simply just have more free time as there'll be less admin, or you will be more efficient in your daily tasks. I think the main reason for upskilling your practice is simply to remove a pain point for your patient. A patient often comes to you with a need or a pain point, and typically you can partially assist them with this, and often you'll have to refer them on where the resolution of their treatment can be completed by another doctor or another healthcare professional. Now, instead of sending the patient somewhere else, you deal with their pain point yourself. This saves the patient another visit with another doctor. It also saves them extra costs, and ultimately it gives you more income because you can bill for more procedures or more of your time. As I mentioned earlier, all of these things are there to simply better work with your lifestyle. If you want to make more money or see more patients, then great, this allows you to do that. If work balance is more your thing, then this will simply allow you to be more efficient so that you have less work and more time to focus on the things that you want to focus on. I hope this video helped you in trying to get some ideas, or perhaps if you're starting your new practice, I hope this helped you in gaining some extra knowledge on how you can improve your new starting practice. Please comment below if there's something that you think I missed so I can add it to a future video, and I'll see you guys in another video soon. Thanks very much. Bye.